Back now on Triad Today, and always glad we can spend a few minutes with the good folks at Northern Regional Hospital up in Mount Airy. And this is a returning guest. We don't have her here often enough. She's so busy, but glad that she's back now. Dr. Elizabeth Bond is General Surgeon at Northern Regional Hospital. Welcome back.
Thank you so much for having me.
Let's talk about how common breast cancer is either in this area or nationwide or whatever. You have any statistics or feeling about that?
Yes, so breast cancer is one of the most common cancers, and it actually occurs on average in 1 in 8 women, which is 12% of women. So it's pretty common, and I think that one thing that's important about breast cancer is how many people it affects. Everyone knows someone, whether it's a family member or friend, who has had breast cancer or who has passed from breast cancer.
Right. And I guess this question, it sounds like a stupid question, but why is screening so important? I know that follows what you just said, but why is it so important?
So screening is important not only because breast cancer is very common, but because the sooner the breast cancer is found, or even before it becomes a breast cancer and can be removed and treated, the earlier stage that the breast cancer is when it's discovered, the better chance that that woman has to be a survivor of breast cancer.
All right, Doc. Now, what about women who ask the question, well, when should I start having mammograms?
So in general, we recommend that women with an average risk of breast cancer start getting their mammograms at the age of 40. Of course, that's something that's very individual for each patient, and they should talk to their personal doctor to decide whether or not they have any risk factors that would lower that age.
I'm glad you mentioned risk factors. Can you give me a couple examples of things that put you more at risk?
So one thing that we kind of take for granted is gender. So obviously breast cancer is more common in women. Of course, it's important to note that it can occur in men as well. But being female is one of the highest risk factors, as well as increasing age.
Now, let's say that you've diagnosed this and the woman meets with you, and you're a surgeon. So what are her options? What do you do with her and for her?
So I'm a general surgeon, so I do a lot of different types of surgery, but one of the types of surgeries that made me interested in becoming a surgeon was breast cancer surgery. I think that the relationship between the surgeon and the patient is very important. And so I discuss with patients that there are surgical options. One option in some patients is a lumpectomy, which is just removing the breast cancer and trying to leave the normal breast tissue. And some patients elect to remove the whole breast, which is a mastectomy.
Right. And you and I have talked about this before, but I want to repeat it because I actually do hear this from women who say, I understand what the doctor's saying, but I don't want to know. What do you say?
So I think that that's everyone's choice to, I just let patients know that I want to give them all of the information that they need to make an educated decision. In patients who don't want to know, as long as they understand the risks of that, there's nothing I can do to convince them otherwise, and that's okay. But I do encourage them that the sooner we find something, the more treatable it is.
Absolutely. And as you said, the options are there with various things, some that involve surgery. And I just think what you're doing is so important, and I appreciate what you're doing to help people and to save lives. I want to put this general website up on screen, though, while I'm thinking about it. ChooseNorthern.org is the general website for Northern Regional Hospital, and I hope you will check that out. But Doc, thanks so much for the information that you're sharing with us. It's so important year-round, not just in special months. Will you come back sometime?
Oh, of course. Thank you so much for having me. I
All right.
appreciate it.
We'll be right back after this.